worked editing a magazine called Multinational Monitor that looked at multinational corporations and global economic issues. It's when I first kind of started to think about the issues of global tobacco control and identifying big tobacco as one of the, if not the worst sector of corporate misbehavior. And did some reporting on it, talked to some of the leaders around the world working on global tobacco control. So I had an orientation around the issue. In the mid and late 1990s, as a number of US state lawsuits against big tobacco were really heating up, a proposal emerged for what was called a global settlement of those lawsuits that would have settled all of the lawsuits in the US and actually prevented any future lawsuits in the US against the tobacco companies in exchange for a lot of money and some significant changes in the way big tobacco pledged to conduct itself going forward. Pretty much missing from that story, though, despite the terminology of a global settlement, was consideration for the rest of the world. And I started to focus in on that issue. My sense is that one thing that OSF really did was keep the advocacy alive and prominent, and the organizations around the world funded, so that it was an energized and exciting enough place for these bigger players to subsequently get in. So after we did that original thing opposing the so-called global settlement, we created a program that was a buddy system to partner those local and state tobacco control groups I was talking about with groups overseas. And the idea was there could be an exchange of expertise and knowledge. Actually, were so many of these U.S. groups that had done so much. They had some things to teach, especially about smoke-free areas, which were really novel at the time, but spreading quickly, and the direct result of local advocacy. And they might have access to different kinds of resources. At the same time, there were things for the developing country groups. We were mostly focused on developing countries to teach the U.S. And also to sort of explain what was going on in their countries and sort of educate the U.S. groups, so the U.S. groups could become advocates in the United States for global tobacco control measures. Pharma, when it comes to access to medicines and either advancing or creating exceptions and limitations to drug companies' patents and monopoly protections, big pharma has relied really, really heavily on the U.S. government to beat up other countries. Jamie Love, I think, was the first who had done work on U.S. government support for pharmaceutical R&D, was the first to really see the impact of the U.S. trying to impose U.S.-style patent and other monopoly rules on developing countries, and the first to start to see the pressure that the U.S. government was bringing to bear on these countries on behalf of big pharma, and then the first to understand the possibilities for access, the pain that would come from monopolies and high prices, and the possibilities that would come from generic competition and lower prices. At the same time, as you referenced, the global AIDS epidemic was really intensifying, and around the world, and especially in Africa. And as that was happening, we were also reaching a point where drug treatments were now becoming available in the U.S. that were really effective. So what had, where an HIV/AIDS diagnosis had been a death sentence, just a few years before, people in the United States, people were, beginning to survive and thrive, and that was with drugs, which, by the way, were largely developed and funded by the U.S. government. In the developing world, with the spread of HIV, and those drugs just weren't available in poor countries because they were priced the same in poor countries as they were in the United States, which at the time was $10,000 to $15,000 a year per person. well, $10,000 to $15,000 a year per person in countries where the per capita income might be 800 or less. Just virtually no one could afford that. So Jamie went to a meeting of New York ACT UP and talked about this issue. The people were focusing on it in the community, especially AIDS activists who would themselves receive treatment. But their focus had just been in sort of thinking about the drug companies. Jamie talked about this idea that we were focused on of compulsory licensing, that instead of just asking them to lower prices, you could enable generic manufacturers to compete. And we knew from from generic manufacturing history, like the price comes down a lot when you have a bunch of generic manufacturers. The price comes down typically 80, 85%. So that's pretty game changing. And we had reason to believe it could be more in this space. So, a series of conversations and meetings, and a bunch of AIDS activists from New York ACT UP and Philadelphia ACT UP and others sort of really took this issue on. So there had been a U.S. South African commission formed to facilitate friendship post the transition from apartheid. It was headed by then Vice President Gore and then South African Vice President Thabo Mbeki. It's called the Gore Mbeki Commission. And it turned out, as we discovered from documents obtained under the Freedom of Information Act, that a big part of what this commission was doing was serving as a vehicle for the U.S. to beat up on South Africa to undo or scale back this patent law. So we tried to give some guidance, some advice to the South African government about what to do about it and so on. But anyway, the story, we started to get a little bit of attention to the story, not much. But the AIDS activists latched onto this. And then in the summer of '99, or spring, when Al Gore announced that he was going to run for president, like literally when he said, "Today I'm running for president of the United States," he was interrupted by activists who screamed, "Gore's greed kills." If we hadn't had that disruption, we would have had a different history. Like, our arguments were really good. The fact of the epidemic spinning out of control was a fact, starting to get more media attention as it was playing out. The inability for people to get treatment was a fact and getting some attention. But it was that disruption and people's willingness to put their bodies on the line and risk arrest and all that kind of stuff. That's what broke through. Jamie and I went to London and we met with, along with Jamie was a guy named Bill Haddad, and me was a guy named Bill Haddad, who has been worked in the generic industry and helped create the generic industry in the U.S. And we met with a guy named Dr. Yusuf Hamid, who was an Indian doctor who owned a large generic manufacturer in India called CIPLA, C-I-P-L-A. We had a long, all-day conversation, kind of going all over the place about stuff. And Dr. Hamid told us, "Look, these drugs don't cost very much to make, and I can do it." And that was sort of proof of concept for us, because we'd always said this was true, but here's a guy who said he could do it. He'd started to make some of them. In that meeting, and then later on, Jamie really pushed him that we needed a price of $1 a day. That if we could announce that the cost of these drugs were $1 a day, which otherwise were $10,000 a year, that would be transformational. And later on, Dr. Hamid did it, and he announced $350 a year for a 3-drug combination. It's for HIV. With HIV/AIDS, like, we hadn't had an experience like that, at least not in any recent times. With COVID, we had an experience like it, HIV/AIDS. So we should have learned the lesson, and instead of learning a lesson, we actually did worse. It's pretty horrific. We developed the plan. It shouldn't have been public citizen for sure, but we developed what I think is still the best plan for scaling up manufacturing. We created a $25 billion plan with people who were sort of steeped in vaccine manufacturing technology. So, when we presented it to people who were in government, they could sort of raise questions around the edges. Was it 25 billion? Would it have cost 35 billion? I don't know. But we could have done it. And there were shortages of some inputs, but the shortages these were all solvable problems with political will. There's absolutely, it turns out we were pretty willing to let people die who were white, but we're absolutely more willing to let people die who are poor, people of color in faraway countries. So you should not, not you, one should not fail to see the embedded racism in these policy failures.